welcome to the deep dive. Today, we're diving into the world of modern surgery.
We've got a mountain of your research on this one.
Seriously, articles, notes, it looks like you went deep.
That's what we do here. We're tackling the big stuff, think cutting-edge tech, the pressure cooker of the operating room, even a peek into the future of surgery. It's
A lot to unpack.
It really is.
So are you prepping for something? Are you brushing up on the field, or just, I don't know,
Obsessed with scalpels?
maybe? Whatever the reason, we've got you covered.
And to guide us, we have this incredible interview with a seasoned surgeon.
Ooh, a peek behind the curtain. I love it. So where do we even start with something as complex as surgery? What stood out to you about this surgeon? What makes them tick?
You know, it's interesting. It's not just about the technical skill, though.
Which is obvious.
Crucial. But they talked about this drive to have both precision and immediate impact,
Wow.
to directly intervene and change a life, sometimes, like in a single surgery.
Yeah, that combination of meticulous detail and this huge human impact. You don't get that in a lot of fields. But it's not all, smooth sailing in the OR. What about the pressure, the unexpected? How do they deal with that?
That's where it gets really interesting. They emphasize over and over seeing the whole person. They consider the patient's lifestyle, their goals, everything, not just the medical chart.
So it's a lot more holistic than people might realize.
Exactly. It's about understanding how surgery fits into their life, not just like fixing a problem in isolation.
That makes sense.
And they stressed collaboration, big time. Working with this whole team to weigh those risks,
Sure.
benefits, and really bringing the patient and their family into the loop.
So it's not this solo mission. It's more like this.
To have a whole orchestra back there.
Exactly. And I bet even before they, pick up a scalpel, the planning is intense.
Oh, this surgeon was adamant. Pre-op planning is crucial, like a roadmap, knowing the patient's anatomy inside and out, their specific condition, the surgical goals.
Wow.
It all minimizes surprises when things get real.
It's amazing how much happens before they even enter the OR.
It speaks to the dedication for sure, but also how much technology factors in now.
Oh, right. You highlighted robotic-assisted surgery in your notes. Is that something the surgeon uses?
They do. And they called it revolutionary for certain procedures. Think about it, robotic arms controlled by the surgeon.
So it's like an extension.
Exactly. Enhanced precision, smaller incisions, faster recoveries.
Wow. So it's really augmenting their abilities, not like replacing them entirely.
Exactly. They specifically mentioned proctectomies, cardiac valve repairs, procedures where the tiniest tremor matters. That level of precision, game-changing.
It's mind-blowing what technology can do. But I'm guessing there are things that even like the most advanced robots can't replicate.
That's where the surgeon's experience shines through. They mentioned unexpected anatomical variations, complications, things that demand quick thinking, adaptation, that human element.
A robot can't deviate from the plan, but a skilled surgeon can. It's a good reminder that it's still surgery, even with all the, the fancy tools.
Right. And speaking of fancy tools, this surgeon was particularly excited about some things on the horizon.
Like what? Give me the, futuristic surgery rundown.
Okay. Are you ready? 3D printing of tissues and organs, potentially reducing the need for donor organs altogether.
Wow, that would be revolutionary.
Transformative is more like it. Plus, AI-assisted diagnostics imagine the possibilities for complex surgeries. But, and this is a big but, with any advancement, the ethical considerations are huge.
It's not just about what you can do, but what you should do, right?
Exactly. And that ties into another critical aspect the surgeon brought up, handling complications. Because even with meticulous planning, surgery is unpredictable.
Okay, so let's talk about those high-pressure moments. How does a surgeon deal when complications arise during a procedure?
They stress staying calm, methodical.
Which,
Right, when you've got a situation on your hands.
Yeah.
But quickly assessing, finding the root cause, making the best call. That's where experience is invaluable.
It's like that calm in the eye of the storm that separates, a good surgeon from a great one.
Totally. They also emphasize having a top-notch team, people who can respond instantly.
Teamwork, making the dream work, as they say. Speaking of teams, I noticed patient education was a big theme in your notes.
Huge EE. This surgeon believes that informed patients are more likely to follow instructions, leading to better outcomes.
Right. It's not just what happens in the OR.
No, it's about empowering them, not just operating on them.
So it's a partnership, really.
Exactly. Open and honest communication, making sure their patients feel heard and understood. That's their philosophy.
It makes so much sense. But how do you balance Pushing those boundaries, groundbreaking innovations with keeping patients safe.
Patient safety always comes first. They believe in thoroughly testing any new tech or technique, only incorporating it when the safety and efficacy are undeniable.
So it's about really carefully considering the risks and benefits, not just like jumping on the bandwagon of the newest, shiniest thing.
Exactly. They said they start with less complex cases, gradually integrating the new method as their confidence grows.
That's a responsible and honestly reassuring approach. Now, we've talked about the surgeon's approach, the tech, but what about the ethical side? What kind of dilemmas come up in surgery?
This surgeon highlighted challenges around patient consent, managing expectations, and that constant struggle to balance what's medically possible with what's best for the individual.
Which is a lot to grapple with.
Especially when the stakes are so high, right?
Absolutely.
They specifically mentioned the importance of informing patients about all their options, including not having surgery at all.
So it's about presenting a complete picture, respecting the patient's right to choose, even if it means saying no to surgery.
Exactly. Transparency, honesty, empathy, those were their words.
Those are powerful qualities for a surgeon to have. But it can't all be serious all the time, right? How does this surgeon deal with the pressure, the emotional weight that inevitably comes with the job?
Work-life balance is huge for them, whether it's spending time with loved ones, exercising, or just carving out quiet time. They emphasized finding ways to recharge.
It's that classic saying, you can't pour from an empty cup.
Right.
Taking care of yourself makes you a better caregiver.
Right. And they extend that to their team too, fostering a supportive environment where everyone feels comfortable speaking up, prioritizing their well-being.
It sounds like this surgeon is a firm believer in the power of teamwork. But surgery is also, obviously, a constantly evolving field. How does this surgeon stay at the forefront, especially with, new research, new technology constantly emerging?
Lifelong learning is their mantra. They attend conferences, participate in surgical societies, devour medical journals. They're insatiable.
Wow. It's incredible how much dedication it takes to stay ahead of the curve. What about advice for aspiring surgeons? What wisdom did they offer?
They said, stay curious, never stop learning, and don't be afraid to ask questions.
It's like having a compass when you're navigating uncharted territory.
Exactly. And of course, those human skills, communication, empathy, are essential for building trust and delivering compassionate care.
No matter how much technology advances, those human connections remain at the heart of medicine.
Absolutely. And speaking of technology, this surgeon has witnessed a dramatic transformation in their field.
I was just going to ask about that. What were some of the biggest technological game changers they've seen?
They highlighted two things: the shift to minimally invasive techniques and the advancements in imaging and diagnostics.
Right, because those have really changed the game, haven't they?
They really have. For minimally invasive, they specifically mentioned the transition to laparoscopic and robotic-assisted procedures. Smaller incisions, less trauma, faster recoveries. It's remarkable.
It sounds like these technological leaps have significantly improved the patient experience.
Without a doubt. And then, on the imaging front, they talked about how much better MRI and CT scans have become. The level of detail they have now allows them to diagnose and plan surgeries with so much more accuracy.
Makes sense. The more information they have going in, the better they can anticipate challenges and minimize risks, right?
Exactly.
But even with all the planning and technology in the world, things can still go wrong, right? How does this surgeon handle those situations where a surgery takes an unexpected turn?
Adaptability is key, they said. Being able to think on your feet, adjust the plan, and communicate clearly with the team. It's all about maintaining composure and making the best decisions in the heat of the moment.
So it's not just about having a plan A, it's about being able to pivot to plan B, C, or D on a dime.
Exactly. And just as importantly, communicating openly and honestly with the patient and family afterward. They believe in transparency, explaining what happened, why it happened, and what steps they're taking to address it.
In those difficult moments, honesty and empathy can make all the difference for the patient and their loved ones.
Absolutely. Now, another thing this surgeon highlighted was the importance of finding that balance between speed and precision.
That's fascinating. It seems kind of counterintuitive in such a high-stakes environment. Speed and precision don't always go hand in hand.
Right. They said that while efficiency is crucial, especially to minimize anesthesia time and potential complications, accuracy can never be compromised. It's about finding a controlled pace that allows for both.
So it's not about being the fastest surgeon, but the most deliberate and accurate.
Precisely. They said experience plays a huge role in finding that sweet spot, That repetitive practice hones both speed and precision over time.
Like a concert pianist who makes years of practice look effortless.
Exactly. And speaking of precision, this surgeon actually uses 3D printing in their practice.
Oh, that's right. You had that flagged in your notes. I'm so curious to hear how 3D printing is being used in surgery.
It's revolutionizing complex reconstructive surgeries and even pre-op planning.
How so?
Think about it.
Yeah.
They can create these highly accurate anatomical models.
Wait, so they can actually hold a replica of the patient's anatomy in their hands before making an incision?
Exactly. It's been a game changer for surgical accuracy, especially in fields like orthopedics and maxillofacial surgery, where precise bone work is critical.
Wow, that's incredible. It's like having a practice run before the main event.
Exactly. They even use 3D printing to create custom implants and guides tailored to each patient's anatomy.
It's amazing how technology is changing the game. But even with the best planning and, cutting-edge tools, I'm guessing things don't always go smoothly after surgery either. What are some of the post-surgical challenges this surgeon mentioned?
They see it all: infection, bleeding, blood clots. They stress the importance of meticulous care, from sterile techniques to closed patient monitoring. It's about minimizing those risks as much as possible.
Of course, preventing those complications is always the goal. But what about when things do go wrong? How does the surgeon approach those situations?
Early detection and intervention are key. That's why those follow-up appointments are so crucial. It's about catching any problems early on. They're looking for any signs of infection, monitoring the wound, and intervening as needed. They emphasize that surgery is often a journey, not a one-time event, and they're with their patients every step of the way.
It sounds like they are incredibly dedicated to their patients' well-being. But caring for elderly patients who are having surgery must present its own unique set of challenges. How does their approach differ when treating older adults?
They're incredibly mindful of the unique needs of their elderly patients, yeah. They take this comprehensive approach, considering not just the patient's age, but their overall health, any pre-existing conditions, even their nutritional status.
Because all of that can influence surgical risks and recovery.
Absolutely.
It's about seeing the whole person, recognizing that aging brings its own, considerations.
Exactly.
Yeah.
And often, that means modifying the surgical approach.
Yeah.
They often opt for less invasive techniques for elderly patients to minimize trauma and promote faster healing.
It sounds like they're constantly adapting their techniques to provide the best possible care for each individual patient. But as we've discussed, surgery isn't just about the technical aspects. How does this surgeon handle those sensitive conversations, when they have to deliver difficult news to a patient or their family?
They said it never gets easier,
Yeah, right.
but they approach those conversations with honesty and compassion, always prioritizing clear communication.
Of course.
They make sure the patient and family understand the situation fully while offering emotional support and creating space for them to process the information. It's about being present in those difficult moments, not just delivering news.
It's a good reminder that surgeons aren't just, skilled with their hands. They're also dealing with these complex emotions, human experiences.
Right.
They're with patients during some of the most vulnerable moments of their lives.
Absolutely.
Speaking of, dealing with complex situations, how does this surgeon ensure they're continually improving their own skills and knowledge, even after all these years of experience?
They're incredibly self-aware and committed to constant growth. They meticulously track their surgeries, from complications and recovery times to patient satisfaction, and they analyze that data, looking for areas to improve.
It's like a data-driven approach to self-improvement. Fascinating.
Right. And they don't just look at the numbers. They also value feedback from colleagues and patients, believing that everyone has a different perspective that can contribute to their growth.
It's refreshing to hear a surgeon who's so open to feedback and improvement, but I'm guessing they can't be an expert in every single surgical technique. How did they decide when it's time to refer a patient to a different specialist?
They believe their primary responsibility is to the patient. So if that means recommending a different specialist or a multidisciplinary approach, they don't hesitate.
So it's about putting the patient's needs above, any sort of ego or anything like that.
Yeah, knowing their limits and having a network of trusted colleagues they can refer patients to.
It's about prioritizing the patient's well-being above all else.
Exactly. Now, we've talked a lot about the demands of surgery, the long hours, the critical decisions, the emotional toll. How does this surgeon prioritize their own well-being and prevent burnout for both themselves and their team?
Yeah, that's a great point.
They believe in leading by example. They emphasize setting boundaries between work and personal life, carving out time for themselves. Whether it's with family, hobbies, or simply quiet time, they know they're a better surgeon when they're feeling refreshed.
Of course. Yeah.
And that extends to their team as well. They foster a supportive environment where everyone feels comfortable taking breaks, setting boundaries, prioritizing their own well-being.
It's about recognizing that self-care isn't selfish. It's essential for being the best version of yourself, both in and out of the OR.
Exactly.
Now, we've touched upon minimally invasive techniques, but I'd love to hear more about how this approach has changed the landscape of surgery.
Oh, they've fully embraced those techniques, particularly laparoscopic and robotic-assisted procedures.
Right.
They see them as a win-win for both patient and surgeon. Smaller incisions, less trauma, faster recoveries. It's revolutionized many traditional procedures.
It's remarkable how much surgery has evolved, even in recent years.
It really is. And this surgeon is passionate about passing that knowledge on to the next generation. They're a huge advocate for strong surgical training, focusing on both technical and interpersonal skills.
It's about training well-rounded surgeons who are not only technically skilled, but also compassionate and communicative.
Exactly. They believe in a hands-on approach, providing residents with ample opportunities to observe, assist, and gradually take on more responsibility in the OR.
It's about learning by doing, under the guidance of an experienced mentor.
Precisely. They emphasize giving constructive feedback to help residents learn and grow, creating that safe space to make mistakes and learn from them.
It's about nurturing the next generation of surgeons, ensuring they have the skills and support to thrive in this demanding field.
Absolutely. And they stress that learning never truly ends. They encourage all their trainees to remain curious, always questioning, embracing lifelong learning in surgery.
Because it is a field that's constantly evolving. So besides technical skill, what qualities do you think this surgeon values most in their peers? What sets a truly exceptional surgeon apart?
It was fascinating. They said it's a blend of technical and interpersonal brilliance. Of course, dexterity, attention to detail, remaining calm under pressure, those are essential. But they also place huge emphasis on empathy, compassion, and strong communication skills.
It's about connecting with the person behind the patient, building that trust that's so vital in medicine.
Exactly. They believe those human connections are as important as any surgical skill.
Especially when you're dealing with patients from diverse backgrounds, different cultures and belief systems. How does this surgeon ensure they're providing culturally sensitive care?
They believe in respecting each patient's unique background, understanding that medicine isn't one size fits all. Open communication is key for them, taking the time to understand the patient's perspective, cultural and religious beliefs, anything that might influence their preferences.
It's about meeting the patient where they are, honoring their individual needs and values.
Precisely.
And often it's not just about the patient, right? Family plays a huge role, especially when facing, major surgery or complex decisions. How does this surgeon incorporate the patient's family into the process?
They're a strong advocate for family-centered care whenever possible.
Sure.
They recognize that family members provide essential support and want them involved in those decisions, especially for high-stakes surgeries. They believe in open communication with everyone, making sure everyone understands the diagnosis, treatment options, and potential outcomes.
It's about fostering that sense of partnership between the medical team, the patient, and their family.
Exactly. Now, before we kind of wrap up this deep dive into the world of surgery,
Right.
I wanted to highlight a couple more things from this insightful interview. This surgeon's dedication to cutting-edge technology, particularly in imaging, is really impressive.
Oh, tell me more.
Okay, so they're utilizing intraoperative MRI and CT scans.
Wow. Those are incredibly advanced techniques, but how do they actually work, during surgery?
So imagine, having real-time imaging during the operation. With these techniques, the surgeon isn't just relying on pre-op scans. They can actually take new images while they're operating, giving them that live view inside the body.
Wow, that's incredible.
Right. And think of the precision this allows for, particularly in fields like neurosurgery, where they're operating on the brain, or in oncology, where precise tumor removal is critical.
It's like having a GPS guiding them through the most delicate procedures.
Exactly. Now, along with embracing technology, this surgeon also highlighted something that might seem simple, but it's so crucial: wound healing. They're meticulous about it.
Yeah, it's something we often kind of forget about, but a wound that doesn't heal properly can lead to all sorts of complications and setbacks.
Precisely. And for them, it begins with their surgical technique, minimizing trauma to the tissues during the surgery.
Right.
And then clear post-op instructions for the patient, emphasizing cleanliness and monitoring for any signs of trouble.
It's about empowering patients to be active participants in their own recovery.
Exactly. And for high-risk patients, they might recommend more advanced wound care therapies to
Yeah.
kind of give healing a boost. They're always up to date on the latest techniques.
It sounds like they truly go above and beyond.
They do. Which brings me to my final point. This surgeon had some great advice for aspiring surgeons. They said, and I'll quote this, "Complications are an inevitable part of surgery."
That's a sobering thought, but also incredibly realistic.
Right. They went on to say that even the most experienced surgeons face them. And it's how you handle those challenges that truly defines you as a surgeon.
It's not about being perfect, it's about how you navigate those inevitable imperfections.
Exactly. Their advice was to stay calm, trust your training, communicate clearly with your team, and learn from every experience, even the difficult ones.
It's about turning those challenges into opportunities for growth.
Precisely. They believe that every complication, no matter how challenging, offers valuable lessons that ultimately make you a better surgeon. They see those complications not as failures, but as valuable learning experiences.
Right. It's about using those moments to refine your skills and get even better.
Exactly.
Mhm.
And this surgeon really emphasized that. They said that even with all the experience in the world, you can never truly eliminate the risk of complications.
Of course, surgery is inherently unpredictable.
Right. And that's where their meticulous approach to preparation really stood out to me.
Oh yeah, you mentioned that in your notes. Tell me more about how they prepare for a surgery.
They literally review everything multiple times before even stepping foot in the OR.
Wow, talk about attention to detail.
Seriously. Leaving no room for doubt. That's what they said. And they're also a huge believer in standardized safety protocols.
Like those checklists you hear about.
Exactly. Checklists, timeouts during surgery, all those things that might seem simple.
But can actually prevent major errors.
Exactly. And it's not just about the surgeon themselves. They encourage their entire surgical team to be vigilant.
So it's a collective responsibility for patient safety.
Absolutely. Everyone double-checking, feeling empowered to speak up if something seems off. It's about fostering that culture of safety.
Teamwork making the dream work.
Right. And speaking of teamwork, we talked about patient care during surgery, but what about managing pain afterward?
Yeah, that's a critical part of the recovery process that we haven't touched on yet.
It is, and this surgeon has a really interesting approach. They're a big proponent of what's called multimodal pain management.
Okay, break that down for me. What does that mean exactly?
It means using a variety of strategies to address pain,
Yeah.
rather than just relying solely on, say, opioids.
So a more holistic, multi-pronged approach.
Exactly. They often use a combination of non-opioid medications, things like NSAIDs and acetaminophen.
Right, those are common over-the-counter pain relievers.
Exactly. And they're also big proponents of regional anesthesia techniques whenever those are appropriate for the procedure.
Can you remind me how those regional techniques work?
Sure. It's about delivering the pain medication directly to the nerves that surround the surgical site, so the pain relief is super targeted.
Ah, I see. So it's a much more direct approach.
Right, and that targeted approach also means you can often avoid or minimize the use of those stronger painkillers that can have a lot of side effects.
Which is a major concern these days.
For sure. But even when they do prescribe opioids, they do it very carefully, always at the lowest effective dose for the shortest amount of time.
It's great that they're so mindful of those risks, especially with, the opioid crisis we're facing. But once a patient is discharged, how does the surgeon make sure they're actually following those postoperative instructions? It's one thing to hear it at the hospital, but it's another to remember everything when you're back home trying to recover.
That's such a good point. They really emphasize clear communication. They provide detailed written instructions,
Which is always helpful.
right? But they also go over everything in person with the patient before they're discharged.
So it's not just handing them a pamphlet and saying, see you later.
Exactly. It's about having a conversation, encouraging questions, making sure the patient really understands everything.
It's about giving them the tools and the knowledge to actively participate in their own healing.
Absolutely. And often they'll recommend involving family members or caregivers in those conversations to provide that extra layer of support at home.
That's a great idea because especially in those first few weeks after surgery, having that extra pair of hands or someone to remind you to take your meds can make all the difference.
Absolutely. It takes a village, as they say. But unfortunately, even with the best care and the best intentions, sometimes complications can still arise after a patient goes home.
Right. Surgery is a process and setbacks do happen.
Yeah.
So how does the surgeon handle those situations where Let's say a patient develops an infection or has issues with wound healing after they've been discharged.
They are all about addressing those issues quickly and aggressively.
Of course, time is of the essence in those situations.
Exactly. That's why they emphasize those follow-up appointments so much.
Right, to catch any potential problems early on.
Exactly. They're looking for any signs of infection, monitoring the wound closely.
Mm.
I love that they said this. They said, surgery is a journey, not a destination.
Oh, I like that.
It's that continued support, that open communication that really makes a difference for patients.
Absolutely. Now, we've talked about a lot of different types of patients that the surgeon sees, but you mentioned that caring for older adults, especially those undergoing surgery, presents some unique challenges.
It does, and it was fascinating to hear their perspective on this.
What stood out to you about their approach?
They don't treat elderly patients as if they're just, older versions of younger patients.
Right, they have their own unique set of considerations.
Exactly. And this surgeon really gets that. They consider the patient's overall health, any pre-existing conditions, their medications, even their nutritional status, all those factors.
They're really looking at the whole picture.
They are. And that might mean modifying the surgical approach, opting for less invasive techniques whenever possible, adjusting the anesthesia plan, and being extra vigilant with postoperative care.
Because recovery can look very different for, say, an 80-year-old compared to a 40-year-old.
Exactly. It's all about individualizing the care. And then there's the emotional aspect of surgery, which we've touched on.
Right, like those difficult conversations that surgeons sometimes have to have with patients and families about unexpected outcomes or diagnoses.
Exactly. Those conversations are never easy. They said honesty and compassion are key.
Of course.
And being able to clearly communicate what's happening, but also creating space for the patient and family to process those emotions.
It's about being present with them in those difficult moments.
Exactly. And it made me realize that emotional intelligence is such a crucial part of being a surgeon.
Absolutely. It's not just about having steady hands. It's about having a steady heart as well.
So true. Now, on a lighter note, I'm curious, with all that this surgeon has accomplished, all their experience, how do they make sure they're continually improving, staying at the top of their game?
Yeah, it's like that saying, what got you here won't get you there, right?
Exactly. And they all about lifelong learning, attending conferences, reading journals, staying updated on the latest research.
Keeping their finger on the pulse of the field.
Yes. But what really impressed me was their dedication to tracking their own surgical outcomes and using that data to drive improvements.
Oh, wow. So they're not just relying on like gut feelings or anecdotal evidence. They're looking at the numbers.
Exactly. They track everything, complication rates, recovery times, patient satisfaction scores, and they use that data to identify areas where they can improve.
That is so impressive, that commitment to constantly looking for ways to do better, even when you're already at the top of your field.
I know. And they don't just rely on data either. They also seek feedback from their colleagues.
Because everyone has a different perspective, right?
Exactly. They're constantly asking, how can I do better? What can I learn from you?
It's so refreshing to hear about a surgeon who's so open to feedback and improvement. But even with all that expertise, I'm guessing they can't be a specialist in every single technique. So how do they decide when it's time to, refer a patient to a different surgeon?
That's such an important question, and it really speaks to this surgeon's humility. They said their primary responsibility is always to the patient's well-being.
Of course, that's always the priority.
Right. So if a patient needs a procedure that's outside their specific area of expertise,
They're not afraid to say so.
exactly, they'll refer them to a colleague who might be a better fit.
It's about putting the patient's needs above all else.
Exactly. It's about recognizing that you don't have to be the best at everything.
And that it's okay to ask for help when you need it.
Right. And speaking of collaboration, we've talked a lot about how important teamwork is in surgery, especially in those high-stakes moments.
Right, when things get intense in the OR.
Exactly. And this surgeon really emphasizes the importance of building a cohesive team. Like, they start every single surgery with a team briefing.
Oh, that's a great idea.
Right. They outline the plan, discuss potential challenges, make sure everyone's on the same page before they even begin.
That makes so much sense. Because communication is key in those situations.
Absolutely. And they encourage everyone on the team, nurses, anesthesiologists, everyone, to actively participate in these briefings, voice any concerns they might have.
It's about creating that environment of open communication and mutual respect.
Yes. And they also believe in clearly defining roles and responsibilities within the team.
So that everyone knows what's expected of them, how their specific role contributes to the overall success of the surgery.
Exactly. And that clarity really helps things run smoothly.
Absolutely. Now, we've talked a lot about the surgeon's approach, their philosophy, but surgery is a field that's constantly evolving, with new technologies and techniques emerging all the time. How do they decide when to implement something new into their own practice?
They're definitely not the type to jump on every bandwagon. They're very much about evidence-based medicine.
So they're not just going to try something because it's new and shiny. They want to see the data first.
Exactly. They want to see that solid research, those clinical trials, before they incorporate anything new.
Hmm.
And even when the evidence is strong,
It doesn't stop there.
no. They seek out additional training, practice in a controlled environment before they ever try anything new on a patient.
That's really impressive. They're not willing to compromise on patient safety, even when it comes to innovation.
Exactly. They said they often start by incorporating new techniques gradually, maybe trying them out on less complex cases first to build up their confidence and experience.
That makes sense. It's about being cautious and responsible, especially given the stakes.
Exactly. And it made me think about how we often focus on, like, the glamorous side of surgery, those state-of-the-art hospitals, cutting-edge technology. But the reality is a lot of surgery happens in settings with very limited resources.
Right. Access to healthcare is a huge issue globally.
Exactly. And the surgeon has actually worked in those resource-limited settings. They said the biggest challenge is often the lack of advanced equipment and technology that we often take for granted.
I can imagine. So how do you adapt your surgical skills to those situations?
They talked about having to get really creative, relying more on those fundamental surgical techniques, but they also emphasized the importance of advocating for better resources in underserved communities.
So it's not just about making do, it's about pushing for better care for everyone.
Exactly. And speaking of better care, this surgeon is really passionate about informed consent, which we've touched on briefly.
Right, it's a crucial aspect of ethical medicine, especially in a field as, invasive as surgery.
Absolutely.
Yeah.
And for them, informed consent isn't just about getting a signature on a form. It's about empowering patients to make informed decisions about their own bodies.
Making sure they really understand the procedure, the risks, the benefits, all of it.
Yes. And they avoid using medical jargon.
Because that can be so confusing for people who aren't in the medical field.
Exactly. They're all about clear, straightforward communication. And if a patient is struggling to grasp a concept,
They take the time to explain it in a way that makes sense to them.
exactly. Sometimes they use visual aids, sometimes they involve a family member, but they always make sure the patient feels heard and understood.
It's about creating that partnership between doctor and patient, not just a one-way exchange of information. Now, we've talked about a lot, but I want to circle back to something that's come up throughout this whole conversation: the importance of staying up to date with the latest research and guidelines in such a rapidly changing field. It sounds like this surgeon is incredibly committed to lifelong learning.
Absolutely. They're constantly reading medical journals, attending conferences, surrounding themselves with the latest research. But they're not just passively absorbing this information. They critically evaluate everything, always asking themselves, does this make sense? Is there strong evidence to support this?
They're not afraid to question things or think critically about what they're reading.
Exactly. And that's what I find so impressive, their commitment to always learning and growing, even after all these years of experience.
It's inspiring, honestly, and I think it speaks to their dedication to providing the best possible care for their patients.
Couldn't agree more. They said something that really resonated with me. They said, I'm always striving to be a better surgeon today than I was yesterday.
It's amazing to hear about someone so dedicated to their craft, even after all these years.
Yeah, it's a really inspiring approach.
And it just drives home the point that, surgery, despite all the advancements, it's still deeply human.
It is. It's about so much more than just, the technical skill.
Exactly. So much of what we've talked about today has been about those human elements, the patient education, the shared decision-making, building those relationships.
It's those connections that really make a difference for patients.
Totally. So as we start to wrap up this deep dive, what's really resonating with you from everything we've covered?
It's funny. With all this talk about cutting-edge tech, robotics, AI.
Which is all incredibly exciting, right?
Oh, absolutely. But I keep coming back to that human element, that surgeon's emphasis on compassion, on really seeing each patient as an individual.
That's what makes a good surgeon a truly great surgeon.
Couldn't agree more. It's those intangible qualities, the empathy, the communication skills, the ethical decision-making.
And that commitment to lifelong learning, always striving to be better.
Right, never being complacent. It's a good reminder for all of us, no matter what field we're in.
Absolutely. This deep dive has really given me a lot to think about. And I love how you've woven in insights from all these different areas, not just the technical stuff, but also the ethics, the patient experience, the future of the field.
Well, and as you continue exploring, here's a final thought to ponder.
I love it. Hit me.
We've talked a lot about the surgeon of today, right?
Yeah, with all the incredible skills and knowledge they bring to the table.
But what about the surgeon of the future? What qualities will be most essential in a world where AI and robotics are playing an even bigger role in the operating room?
That is a fascinating question. It makes you think about what it means to be a surgeon in an age of increasingly sophisticated technology.
Right. Will those human skills become even more important as technology takes on some of those technical tasks?
I have a feeling this is a conversation we'll be having for years to come.
Me too.
Hmm.
But I have a feeling this surgeon will be leading the charge, shaping the future of surgery with wisdom and humanity.
Well, on that note, we're going to wrap up this deep dive into the world of modern surgery. It's been an absolute pleasure to explore this fascinating field with you.
The intricacies never cease to amaze me. Until next time, keep those minds curious and keep those questions coming.